Hello, everyone. My name is Amelia Croney, and I'm presenting on the global acceptance and wellness of LGBTQ people. So a little bit about myself. I'm a rising senior at Brentwood High in the United States. And this topic is important for me to present on due to my experience in how spreading this information can positively impact the LGBTQ community. Some examples of this are advising Vanderbilt medical residents on how to provide inclusive healthcare, discussing the state of youth education with Teach for America, volunteering with various organizations, including the Human Rights Campaign, Franklin National Pride, and the Oasis Center, which is a youth serving center in Nashville. Just to sum up really quick why this needs to be discussed and brought into the field of public health, and the CDC said it best. The perspectives and needs of LGBT people should be routinely considered in public health efforts to improve the overall health of every person and eliminate health disparities. There are three big topics of discussion I'll be going over today. How much of the population identifies under the LGBTQ spectrum, the state of worldwide acceptance and how it is changing, and then, of course, how these issues can be addressed through public health. So to start, just how much of the world is being affected by the acceptance of LGBTQ people. Right now, 9% of people around the world self-identified as LGBTQ, aka not heterosexual. And that is split up by country here on the right. It's important to remember that these are self-identifications, so the number of people who may actually be affected may be a little bit higher or at least a little bit different because of the way that these surveys are done. Separate of this, 1% of all adults and 4% of Gen Z identify as transgender or gender nonconforming. I include this 4% because the terms surrounding transgender are fairly new, so the younger populations may more accurately represent the amount of the population that is affected. Now, these numbers are really important to bring up because it's not a small number of people who are affected by how accepting and how affirming their countries are of their identities. It is a huge amount of the world, approximately a tenth of the world, that are affected by these issues. So let's start with just the acceptance of homosexuality. This graph here on the right presents the percentage of the population by country that thinks that homosexuality should be socially accepted. As you can see, it varies extremely widely. The most accepting countries include Canada and Western Europe, which is followed by the United States and South America, then approximately by Central Asia, and finally Africa, Western Europe, and Russia fall at the bottom as far as acceptance. Overall, about half of people worldwide believe that homosexuality should be socially accepted. Now, this percentage is heavily divided from only 7% of people in Nigeria to 94% of people in Sweden. However, still only 16 out of 34 countries surveyed had a majority who believed that homosexuality should be accepted. And now onto the acceptance and rights of transgender people. I've got a similar map here on the right when a score was given to each country from 0 to 100, and it was based on the percentage of the country's population who support gender-affirming surgeries, changing ID documents, government discrimination protection, and rights of transgender people to marry, give birth, and adopt. And it's important that we split up transgender and homosexuality or LGBTQ people because transgender people are often facing much more discrimination, especially right now. About a third of US citizens believe that society has gone too far in allowing transgender people to dress and live as their gender. Across the 4 English-speaking countries surveyed, only 2 in 5 people said that they would use trans men and women's correct pronouns. And overall, only about half of the world believe that transgender people are a natural occurrence. So it's clear that trans people are fighting pretty hard to get just general acceptance across the population in their countries. And the reason that these numbers bring in such a huge impact on the LGBTQ community is because low levels of acceptance are tied to bullying and violence, physical and mental health problems, discrimination in employment, and underrepresentation in positions of civic leadership. And that was said by Andrew R. Flores, Williams Institute, and he was one of the main researchers in many of these research projects that I've presented. Just to give one example of how much effect that this can have on people, in the United States, according to a 2023 survey by the Trevor Project, 41% of LGBTQ youth seriously considered suicide in the past year. Now, mental health and suicide risk are already huge problems, especially among youth, but for LGBTQ people, it is compounded and made significantly higher. It is still higher among people who are trans, of color, under 18, or without access to gender-neutral bathrooms, gender-affirming clothing, those who are subjected to conversion therapy, and those who are not affirmed in their identities in their home, school, community, or in their online platforms. Now, the views of this are changing. 36% of people reported their mind being changed on the legality of same-sex marriage in the past 5 years. In the US, the population accepting of homosexuality went from 49% to 72%, which is quite a leap, especially when we're talking about social change, in just over a decade. And then 59% of people believe that the country is becoming more tolerant of transgender identities. So why is this so important, and why does the acceptance tie into LGBTQ wellness? As we've seen, a well-informed and accepting society is beneficial to the wellness of the entire LGBTQ community. Doctors, scientists, and healthcare workers have some of the greatest platforms to spread positive change. And I include this as I'm speaking to young people who are likely going to be these healthcare leaders of tomorrow across the world. Being able to spread information and be accepting and aware of the difficulties faced by LGBTQ people can help them more than just the patients, but the entire community as well. From providing equal treatment and staying informed on current issues to actively creating safe spaces for LGBTQ people, the future of public health can become equitable to all genders and sexualities. And here are my references. And thank you so much for watching. And here's my information. Thank you.